What was your most memorable experience serving as president?
As president, what I really wanted to do in the outset is to make the public and our body of medicine aware of who dermatologic surgeons were. So the most important thing that I accomplished and that I remember is our public relations campaign, not only to the general public, but also to our fellow physicians.
What were the issues facing the society at the time?
The issues facing the society when I was president and in the past and even today are lack of recognition by our fellow physicians of just what dermatologic surgery means, and also a lack of appreciation from the general public of what defines a dermatologic surgeon versus a dermatologist or another doctor. This plays real importance in the treatment of both skin cancer as well as cosmetic surgeons, because many people don't realize what cosmetic surgery is. And so we were tasked with informing the public of just what a dermatologic surgeon is and why a dermatologic surgeon is probably the best person to do both cosmetic procedures as well as skin cancer surgery.
What were the most significant innovations in dermatology at the time?
When I was president, the innovations were in cosmetic surgery. Skin cancer was always there, but it was cosmetic surgery, especially laser surgery and the injectable procedures, which were really coming in vogue. More procedures regarding skin tightening and rejuvenation were coming to the forefront, as well as body contouring procedures. Probably the single best thing I did as president was establish the Cosmetic Surgery Fellowship Program. We really needed to establish a program where as dermatologists, after their training as dermatologists, could then go on with additional training in cosmetic surgery. The Mohs College had given us an outstanding reputation and training for dermatologic surgeons regarding skin cancer, and what I was tasked with and what my vision was is to do the same thing for cosmetic surgery. Now in its 5th year, the Cosmetic Surgery Fellowship Program has really blossomed with over 25 cosmetic surgeons being trained every year by American Society for Dermatologic Surgery.
And looking back at your career, is there anything you would change or do differently?
Probably the one thing I didn't do properly, or the one thing that didn't come to fruition, was increasing our membership. I think increasing our membership, both within the United States as well as internationally, is really important. What I believe will happen is with more public and physician awareness of just who dermatologists are and what the American Society for Dermatologic Surgery can accomplish will increase that membership.
What advice would you give today's young dermatologic surgeons?
What I tell all my residents and fellows and any young dermatologic surgeon is follow your passion. If your passion is to treat skin cancer, go for it. If your passion is to make people a more beautiful version of themselves, go for it. The most important thing is to do what you really want to do. You know, many people have said that you cannot accomplish anything without taking the first step. And so just take that first step.
What are your predictions for the future of the specialty?
Dermatologic surgery will continue to advance the frontiers of both skin cancer as well as cosmetic surgery. My prediction is, although we're really good at cutting out skin cancer and curing patients of skin cancer, what the future really entails is becoming more oncologic. So not having to cut, but using different biologics and medications and pharmaceutical techniques, as well as lasers, in order to treat skin cancer without cutting. You know, a long time ago, one of the foremost surgeons, Hunter in England, first said, "The mark of a great surgeon is one who does not cut." And I think that's the future for dermatologic surgery. Less cutting up of people, more curing people.
What advice do you have for ASDS leadership in serving its membership in the future?
That's a hard question. My advice to the leadership is to continue to promote dermatology and the aspect of dermatologic surgeons both to the general public as well as to our own house of medicine in order to continue to put us at the forefront of not only dermatologic surgery for skin cancer, but also the performance of cosmetic procedures.